Our first item on our housekeeping list. First, I would like to direct you to the control panel on your screen. If you're joining us online, at the top of the control panel, you will notice an orange arrow that points left. When you click on this button, the control panel will open. Here you will see audio options and a question section. You can hear our webinar today either through your computer's audio or on your phone. A dial-in phone number is listed here. Below this section is the question section. If you have questions for Angell that you have not sent her prior to the Q&A session, please type your questions here and press send. When you exit the Q&A session, you will receive a short survey. We invite you to take a moment to participate in the survey so we can continue improving. After the webinar is done, we will email you a recording of the Q&A session and a link to a handout. All right, with the housekeeping items out of the way, I'm pleased to turn the time over to Angell.
Well, good morning or good afternoon, depending where you are, everyone. I'm very excited to meet with you today and have a lot of great information to cover. So just to clarify, if you're on this call, you are a current Pinnacle client who has the product Home Health CAHPS surveys, Hospice CAHPS surveys, or both. To start out, I always like to remind you where Pinnacle came from. Our founder and owner is Stan Magleby. 20 plus years ago, he was an owner-operator of a nursing home and a home health agency. At that time, he found a voice that was not being heard, the patient's voice. He started a consulting firm, and that many years ago was listening to patients, helping agencies understand how to better serve their patients' needs. Over time, Pinnacle grew, serving patient satisfaction needs along with employee engagement for every post-acute and senior care industry. When the CAHPS survey came along, Stan decided this survey would benefit home health and hospice agencies. Let me tell you, Stan would love to meet each one of you because at his heart, he is the company motto, people are our purpose. Now, I joined Pinnacle 6 years ago as a home interviewer. After 3 years, I was able to move to the office and work as an account manager, specifically focused on the CAHPS surveys. Please know that it is my privilege to work with you, knowing how much good you are doing for your patients and their families in your communities across the nation. Many questions I answer can be found on the official CAHPS websites. Take note of these and check them at least twice a month for any new announcements concerning the CAHPS surveys. For home health, it is homehealthcahps.org, and for hospice, go to hospicecahpssurvey.org. Excuse me. If you have any complaints, excuse me. If you have any complaints, questions, or comments on how to improve the CAHPS survey, contact these people. They listen. And the more feedback you provide to them, the better they can make the CAHPS survey. So let's jump in and learn. Pinnacle analyzed years of patient satisfaction survey data to see what key drivers or best practices were common to our top scoring agencies, and this is what they found. 7 points for improving patient satisfaction. This will lay the foundation for our conversation later today about CAHPS, so stay awake here. We'll run through these quickly. With each point, I'd like you to write down one way you are failing and one way to improve. If you are doing well in all of these areas, then please talk to me because we need to feature you on our next Lunch with Angell. Keep in mind, these will overlap with each other, and of course, the CAHPS survey will all be important concerning the CAHPS survey. Treating everyone with importance is the first point. And when we say everyone, we mean everyone. Treat others the way they want to be treated with importance. talk with people and be genuine and understand what is valued most. As a caregiver, you cannot go and treat everybody the same. You need to treat people the way they would like to be treated. And I've got a question for you. Who is the most important person on your healthcare team? Well, it's kind of a trick question. When you sit down and think about everyone that makes up your healthcare team, who is the most important person? Well, it's the patient. This is the person that your entire healthcare team needs to get to know, to understand, and serve. This is one way you can do that. Explain to the fourth power. Explain what you will do. Explain what you are doing. Explain what you did. And explain what to do next. I read and approve the comment alerts that come to you, and believe me, I've never seen a patient say, they called me too much. It's always the opposite. In fact, the comment I see the most often is, I didn't know when they were coming. They were late and I waited and waited for them. And the worst that I hear, they just stopped coming and I thought we had another session. That is so sad to hear. This is so key for therapy also. Good therapists practice this very well, explaining what you will do, what you're doing, what you did, and what to expect next. Next, we have exceeding expectations. So expectations are set whether you recognize it or not. This goes along with human nature and how a patient will judge your service from the very first phone call. Again, when you first explain what you will do, you are setting an expectation. And the first home visit, you are making an impression. Are you creating wow moments? Are you doing little things that make your service great versus good? Don't forget to write down one way you can impress on an individual today. Is it writing a note to thank them for something, or researching a little topic about something they're interested in so you can discuss it with them while you're treating them? There are infinite ways to exceed expectations. The next tip, number 4. In January, everyone makes their New Year's resolutions to lose weight. Well, here at Pinnacle, this is our little play on words. Lose the wait time. Time is a precious resource. We all have the same amount of time and need to use it wisely. Now back to our comment alerts. I can't count the many times I've heard, I was waiting for them to call. 1 minute, 5 minutes, 30 minutes. This is an eternity for someone who is waiting for a visitor to come to their door or needing help with a sick loved one. Next, let's make lemonade from lemons. I'll be honest, you will get a bad survey every once in a while. What you decide to do with negative feedback defines who you truly are. Like a lemon, suck it up and learn from it. We all do our best, and sometimes mistakes are made. Sometimes false impressions are given, and we need to learn from them, not cover them up. The quicker you can acknowledge a problem and resolve it, the less your reputation will be damaged. Okay, number 6, let's brag right. Promote success internally. This gives purpose and lets people know that their work is worthwhile and that they are making a difference, which they are. Create a culture focused on success and reward success. And rewards don't have to be expensive. Little things, little recognitions. And I'll talk about a way that Pinnacle helps you recognize your clients later on in this webinar. Make sure you promote success and acknowledge shortcomings externally to build trust. If you can say to someone, I'm sorry we made a mistake, how can I fix it? It goes a long way to making that lemonade. Measure to improve, not just to impress, and not cover up and say that wasn't what happened. And if you ask CMS, this is the main reason for the CAHPS survey. So let me explain something. There are two terms in the survey world. One of them is satisfaction, and the other is experience. The patient experience survey, such as the CAHPS survey, are mistaken for customer satisfaction surveys. Patient experience survey focuses on how patients experienced or perceived key aspects of their care, not how satisfied they were with their care. For example, CAHPS focuses on asking patients whether or how often they experienced critical aspects of healthcare, including communication, understanding medication instructions, and the coordination of their healthcare needs. So you can see there's a difference between experiences had and satisfaction. So lastly, let's just promote honestly. Okay, our last tip for the day is invest in employees. Now here, I'm going to make a shameless plug for a new product called Retain. If this is an area that you're struggling with, contact our business development team for more details. Retain is an online tool that lets you survey employees to track their engagement. Treat your employees with respect. Set expectations. Supervisor relationship needs to be built on trust. So here we go. We made it through those 7 tips. Hopefully you were able to gain some insights into where you might not be doing so well. And don't forget to celebrate the areas that you are succeeding in. Okay, so I want to cover participation requirements next. I get a lot of questions about these. Agencies really need to understand, and we get a lot of questions based off of the size. So smaller agencies want to know, do I need to participate? And this helps you answer that question. So for home health CAHPS, if you have served 59 or fewer home health CAHPS survey eligible patients between April 2018 and March 2019, you may request an exemption from participation. But don't forget, the exemption is good for 1 year only, and you must reapply every year if you want to continue exemption status. And then for hospice, since we're talking to both today, the exemption is based on annual decedents or deaths. And this would be if you had fewer than 50 survey eligible decedents or caregivers between January 1st, 2018 and December 31st, 2018. So the dates are a little bit different. Let's make sure that we understand that. And again, 1 year only, you must reapply to continue your exemption status. In this next section, I want to dive into the CAHPS surveys themselves. So the home health CAHPS has 5 measures, and these measures are basically the specific areas that CMS wanted to focus on and help improvement in. Okay, so home health has 3 composite, which means it's made up of several questions, and 2 global questions, meaning it's one question that makes up that whole measure. And for hospice, there are 8 measures, 6 composite, meaning several questions, and 2 global. And I'll tell you why that's important in here in a bit when we go further in our presentation. So make sure you are spending time every month reviewing your CAHPS report. Now that participation is clear, and we know a little bit more about the measures, the next question I hear the most often is, when does my star rating show up on Home Health Compare or Hospice Compare? I know that's a really big topic out there. And the simple answer is after you've been participating, now this is for home health for 1 year, that's 4 quarters, then your CAHPS data will show up on Home Health Compare if these conditions are met. You have 40 or more completed surveys in the reporting period. Remember that reporting period is 1 year. And the reporting period can begin with any quarter, not just January. Your star rating for home health can be calculated after you have had a total of 70 completed surveys since you've started. And remember, CMS tells customers if a home health agency doesn't have a star rating, it doesn't mean that, it just means they didn't have enough surveys to have a star rating to be calculated in a meaningful way. It doesn't mean that there is something wrong with the home health agency. Now for hospice, after you have been participating for 2 years, it's a longer period of time, that's 8 quarters, and these conditions are met, that you have 30 completed surveys in the 8-quarter reporting period. This is a lot of time. Your star rating will show up. Smaller agencies will not have data available, and it's really to your benefit, so you are not compared to larger agencies unfairly. On the Compare websites, consumers are given a checklist of questions to ask when they're searching for an agency to work with. Are you familiar with these questions? You really should check out the Home Health Compare and the Hospice Compare websites to find out what consumers may be asking you so you're prepared with excellent answers. Okay, now let's take a little bit deeper look into the home health website. And hospice is very similar. Today I'm just going to focus on the home health. So you see these tabs: general information, quality of patient care, and patient survey results. We're going to cover those. So in this first tab, this is your agency information, how people know where to contact you. If it's not up to date, make sure you contact your representative for Medicare and get this corrected. The second tab here is your OASIS data that you submit to CMS. This has its own star rating, or for hospice, this is the HIS data that you've submitted to the CASPER system. Then our patient survey of results, this is where you'll find the CAHPS survey results. This is what we submit to CMS after all of the results in a quarterly fashion. So this is updated every quarter during what they call the quarterly refresh. You'll want to check your data on the official HHCAHPS website 30 days before the refresh. Now that time period is coming up really shortly for home health, so I'm just giving you a warning. Watch for the next refresh data to be available, because I believe at the end of July, we'll have a new refresh. So once again, I'm referring you to use the Home Health CAHPS survey.org website. It's helpful. There's a lot of information there. I'd like to issue you a caution against using the star ratings as a QAPI goal or your main focal point. And let me tell you why. I might get some feedback, some kickback from this, but the stars are cluster rated. That means if you have a 94% one reporting period and you stay the same at 94% the next reporting period, it's possible that more home health agencies could rate higher than you, which means your star rating could still go down. The percentages are more reliable for internal use and tracking. So you can see on this page here, These are the percentages. The star rating is designed to easily show consumers how to compare, the whole point of comparing, your agency compares to other agencies. And really, the best percentage to track month to month is going to be your Pinnacle report percentage, especially considering the data on home health and hospice compare is 6 months to a year old. The CAP survey, I'm going to put a little plug in for it. It shouldn't be a burden, but an opportunity for you to understand the experience your patients are having through a third-party source. So your staff could ask questions to the patient directly, but patients might fear giving them an honest response, which could change their level of care. And the patient may not reveal certain frustrations or problems directly to you. However, as a third party, your survey vendor, Pinnacle, contacts them and they give their honest feedback. And you can find out exactly how they feel. So keep your eye on the survey. All right, the next thing I wanted to cover with you is our website, My Pinnacle. Here is our sample page where I've logged in. And when you first log in, you will see your reports. Very simple, very easy to follow. The most recent reports are going to show at the top, followed by the oldest reports at the bottom. There are some new features, and we are continually adding features to this website to fit your needs, so we appreciate any feedback that you have to give to us about this. There are some very helpful sections already. This is called Add Filter. So here you can filter by sample month, date added, organizations, report type, and even unread reports. And these are the reports that have this blue bar on the left-hand side. You know, that hasn't been read, I need to read that one. This one has, as you can see, it doesn't have a blue bar there. So let's look at hospice is broken up into 3 sections at a glance: interviews and response percentages. Home health is in a 1 report. And they have, once you click on this, takes you to a discussion section. Now this is super helpful when you have a team that is looking at these reports, and here you can see everybody who has access to the reports, and you can see when that person last viewed the report. It's so helpful. You're able to follow discussions on the reports, and this is our latest feature, which I think you're going to love. When you get a report that needs an action item, you're able to assign somebody. This will give them an email notification that you made a comment. So let's just say, Jeff Ellsworth, please look at this patient and call them back. Just as an example, then we click Comment as a task. When we add that comment, you can see Jeff has sent that message, and he's able to look at the report himself, see what the patient said, and resolve the task. When the task is resolved, he needs to say how it was done. I called the patient and resolved their concerns. This is going to give a good amount of accountability for getting things accomplished and not just saying, well, this should be done or needs to be done. This will help your team accomplish these. Okay, so let's take a look at our report here. Same Pinnacle report that you're used to seeing with the cover page. And here is the summary. I want to draw your attention to a few of these totals. So this eligible patients will not equal how many patients you serve each month. The CAP survey is designed to be done for a sample of your patients, so that over the amount of a year, we have basically done all of the population and offered them the survey. So out of 25 eligible patients for the month, you can see how many surveys were completed, how many opted not to take the survey, how many did not answer, wrong numbers, and this last one is basically a catch-all. So if there was a language barrier or the patient is found out they have dementia, can't come to the phone, and there's no one else that can take the survey for them, that would encompass all of these. If any of these numbers are higher than they should be, or this example right here, there are strategies that we can talk about on lowering that and making more completed surveys. This next area is really one of the most important measures that you can look at. How many patients would definitely recommend your agency to others? And it's the top box answer for the question, who would you recommend this agency to someone else? It has to be a definitely and not a probably yes. Here we show you the definitely, and on this side we show you probably and definitely, just so that you know you're at least working on the positive side of things and you don't have anybody saying, no, I wouldn't recommend them. And this total right here is helpful because this shows you how close you are if you're on the border of wondering, is your survey going to get stars or not, and how many you have for the last 12 months is very helpful. This next section, I want to explain some things here on your at a glance page. So with home health, here you can see the 5 measures. Let me increase this a little bit. There we go. Remember at the beginning how I said the measures are composite or global? So care of patients is broken up into 4 questions. So you might be doing super great at question 9, 16, and 19, but not 24. And that's why your score isn't 100%. Okay, so that's how you can kind of chunk down and find out where you need to focus. Look at your scores overall and comparing them with the state average and national average. And then on this far right-hand side, you can see what your monthly score is. You can see your 3-month average, it's like a quarterly, and your 12-month average, which is really overall what your scores are going to reflect on Home Health Compare. We just handed out customer experience awards. So if you had any of these areas above the red line, you're given the opportunity to get an award. And this means that you are a top performer, and please advertise it and let people know you are a top performer. Here at the bottom, we have our global question, rating your agency 9 or 10 is the top box. Unfortunately, you can't do a campaign that says, rate us a 10. You can't produce buttons, but it is okay to say, we have this survey coming out, please answer the survey, and if we did a good job, rate us the highest. There's nothing wrong with asking for a good rating when you are doing excellent work. Okay. Then the next section of the Pinnacle report is going to tell you each of the questions, how they were answered, and really, really get those detailed numbers that you are looking for when you're preparing for your QAPI. Okay. If you have any questions about how my Pinnacle works, let me know. It's a new product, I get it. And with new things come changes, and it takes a while to adjust to change, not a problem. But we're here to help you anytime you need. So let's go back to our slide presentation. We're here. Okay, let's figure out how to find a specific focus area for your QAPI or HQRP meetings. This is really how you go from hoping to a better score to actually making specific goals to improving your score. So once you have a focus area after looking at your reports, adopt that focus area for at least a 3-month time frame. Write the focus area on a board or poster, and this is so everyone can see and remember the goal. And if you need to email it out to people, do that too. You need to put the starting percentage and the goal percentage that you want to reach on the board so people can see that increase, where they need to go. Create 3 action items on the board and make them specific. They need to describe who is going to do what. An example of what not to do is increase our recommend agency to others. Well, of course you want to do that, but you need to give more specific of what to do. So an example of what to do is when the caregivers visit the patients, have them refer to the survey and ask for the highest score possible if they gave good service. That's a specific action item that can be taken. Now, Pinnacle's reports provide comments also that you can use for ideas for areas of improvement that are not covered in the CAP survey, and this is straight from the patient's mouth. When you're meeting their needs, they're going to be happy. And when they're happy, we get better scores, right? All right, and focus on your progress monthly. You're going to have a monthly meeting, of course. Recognize where you have and celebrate successes. Find out what's not working. Maybe after that 3-month time period, you make an adjustment to the goal and move forward. And don't forget to recognize employees when they're mentioned in the survey. That's what I need to show you. Let's go back to the My Pinnacle. Up here in your dashboard, it will say resources. And once you click on that, you will have the chance to generate a certificate. And the certificate, this is an example of what it looks like, where you can put your agency's name and the person, the employee you want to recognize with the date, and your name, and of course sign it and give this to them publicly, right? Recognize the hard work that they are doing. Okay, one other tool that has been going out to a lot of agencies, but I want to get this out to everyone that I can, and we will include it in the handouts that come to you after this webinar. It's a checklist. This tool we've developed so that staff can go over these items step by step, and they tie back to the survey. For example, when you start service, state your name, title, and full agency name. There are so many times in the intro to the script of the CAP survey, a patient does not recognize getting care from the agency. And we cannot do a survey if they say, no, I didn't get care from that agency. So you always want to make sure that you brand yourself. That's why this is one of the first items on the checklist. These other items are also going to tie back to every specific question on the survey. And lastly, your ultimate goal is to provide the best home health care possible to every patient, and you and your team can decide on a more specific goal to put on your checklist, what you want to do each month. Also have patients that are definitely willing to recommend you to others and have no problems with the care. If you're checking off that ultimate goal every time, you're going to be working towards the best service and the best CAHPS scores. Now we realize you cannot make the difference alone. Leaders must influence the staff to make a difference. And when your employees feel cared about and that care is passed along to your patients, you must be the positive influence for your staff to make a difference. I hope this was beneficial for you today. Please reach out to me. I am your dedicated account manager, and thank you for participating in today's webinar. I'll turn the time back to Kim for any questions that we have today.
Thank you, Angel. Okay, if you have questions, this is a great time to ask them. To do so, open your control panel by clicking on the orange arrow that is pointing left. There is a question section where you can type in your question and press send. Okay, it looks like our first question, Angel, is, does the star rating show half stars?
The star ratings do not show half stars. It's only a whole star point.
Okay. Next question. What was the first point I came in late?
Okay, that's referring back to our 7 points for improving patient satisfaction. And it was treat everyone with importance. And we will also have a recording available, so you can catch the first part of the session.
Awesome. And then we have another question here. What is the reporting period for hospice CAHPS?
Okay, the reporting period, well, that's going to refer to the Hospice Compare website, and the reporting period is 8 quarters. It's basically 2 years, but it doesn't start in January. It's a rolling quarter period. Thanks for that question.
Sure. Okay, last call for questions. Let's see. Adam, great question. He asked, how can they access the recording? We are going to email the recording out to everyone, and then we will also post it on our blog and share it that way. So keep an eye out for an email that will be coming in the next 24 hours. Any other questions? Okay, well, it looks like we are going to give you 20 minutes of your day back. Who doesn't like that, right? Okay, we are so grateful that you guys attended the Pinnacle CAHPS QA session, Lunch with Angel. If you do come up with any further questions, please feel free to email Angel at angel.hansen@pinnacleqi.com. And as I mentioned earlier, we will email you the recorded webinar and a link to a handout. We will also include the slides in there so that you can print them. And we will post the recorded webinar on our blog. I wanted to also thank Angel for this Q&A session. We look forward to another Q&A session on the first Wednesday of next month. And until then, have a great rest of your month. Talk to you later.